Hi, everyone. Welcome officially to the Comprehensive School Mental Health Systems virtual meeting hosted by the Medicaid School-Based Services Technical Assistance Center. I'm Jill Bonenkamp, an associate professor of psychiatry at the University of Maryland School of Medicine and core faculty at the National Center for School Mental Health. Our National Center is thrilled to be a partnering organization on the Medicaid SCSS Technical Assistance Center, and we are so glad that you all have joined us here today. So here's our agenda for today. We'll be providing an overview of comprehensive school mental health systems. We know folks may have a wide range of knowledge and work as it relates to comprehensive school mental health. And please know that we've intentionally geared this meeting to be for all. So whether you're new in this space or someone who has worked in this space for decades, please know that we'll be gearing this towards you. We're going to give an overview of comprehensive school mental health systems, and we are thrilled to have partners from Massachusetts to provide specific examples of potential for Medicaid school-based services to expand comprehensive school mental health. We will have lots of time for questions of our partners and dialogue about successes and challenges that you're experiencing in your own jurisdiction. So we encourage you to please start to think about your questions now, and you can go ahead and actually, if you came to this webinar saying, gosh, I have a couple of topics that I really want to know the answers to, you can go ahead and start to put those questions into the question and answer box. So please don't put them in the chat, but please, you'll see there's a little icon next to the chat that says Q&A. So please feel free to start to put questions in there, or if something comes up that you hear over the course of the meeting, please feel free to put those in there. We're going to have lots of time for discussion and to get your questions answered. So with that, let's dive into an overview of comprehensive school mental health systems. First, let me introduce you to our center. We were established in 1995, and our center mission is to strengthen policies and programs in school mental health to improve learning and promote success for America's youth. Our center is co-directed by Drs. Nancy Lever and Sharon Hoover. We also run a community-partnered school mental health program in Maryland, and we highlight this as it keeps us honest in our work that we are working and learning alongside you. We encourage you, if you are not familiar with our center, to check out our center website, schoolmentalhealth.org, for additional resources about school mental health. Okay, so this slide really helps us to understand why comprehensive school mental health is so important. And we know that many of you are joining this webinar today because of this, that you are living and breathing and walking in this youth mental health crisis. And so we wanted to level set and share some of this data as we're thinking about the potential for increased school-based services and increased Medicaid support for school-based services. So these are alarming statistics that we're looking at here today, that we are seeing increased rates of reported suicide attempts. Our second bullet here, that nearly 3 in 5 teen girls experience persistent feelings of sadness or hopelessness. When we think about those numbers, we know that we have to be thinking about a comprehensive approach, that we have to be thinking for not just a few students, but really that this is a widespread issue that we are focusing on. And we know that these rates and these concerns are even worse for youth that may have additional risk factors. And so we want to make sure that we're thinking about this, and this is why we're thinking about comprehensive school mental health. So folks who may not be as familiar with mental health treatment in schools or comprehensive school mental health systems, or may be very familiar but making the case for others in your local jurisdictions, we want to talk about why mental health treatment in schools. So we know that schools provide more mental health treatment services for youth than any other system. This includes outpatient settings, primary care, inpatient. And so when we're thinking about comprehensive care, when we're thinking about addressing our youth mental health crisis, we have to be thinking about schools. In addition to providing more services than many settings, we also know that there's extreme value in mental health treatment in schools, even beyond that value beyond access to services. We see that when schools have comprehensive mental health treatment in schools, we see better academic outcomes, early identification and intervention, positive school climate and safety. When we're thinking about numbers of 3 and 5 youth, we need to be thinking comprehensively about how we're making sure we have positive school climate and safety. And you can see these additional outcomes that really make the case for us for why this is so critical. And I can imagine if you're joining this meeting here today, that you see these things in action. And we're sharing this so you have these data to share back with others as you're continuing to move this work forward in your own community. So when we say comprehensive school mental health, what do we mean by that? So a comprehensive school mental health system includes well-trained educators and specialized instructional and support personnel working alongside families, schools, communities, in collaborating and teaming. There's a focus on needs assessment and resource mapping. And a comprehensive school mental health system includes a multi-tiered system of support. And we'll be talking more about what that looks like and what we mean by that. We're thinking about how are we identifying mental health problems early through mental health screening, using evidence-based and emerging best practices, using data to track our systems. And when we're thinking about comprehensive school mental health, a key feature we're thinking about is how do we fund this? And this is where this meeting and this work here is so critical as we think about Medicaid school-based services. All right, so as promised, when we talk about comprehensive school mental health, we are talking about a multi-tiered system of support. And this means that we are considering and providing services and mental health promotion for all students with the goal of increasing positive mental health and promoting good mental health before we even move towards the need for prevention or intervention. As we move up our multi-tiered system of support, we're thinking about prevention efforts for those who might have small challenges that we wish to institute prevention practices so we can keep those from getting bigger. And then, of course, thinking about how are we implementing school-based mental health intervention services for those who may need additional mental health services and supports. And let me give you a couple examples of what this might look like in practice. So on the next slide, you'll see when we're thinking about mental health promotion for all, this might include classroom discussions on responsible decision-making, relationship skills, and self-management that help students succeed. As we're thinking about prevention services for some, this might be for groups of students who have experienced a loss to support them and prevent challenges. And then as we move up, we may think about specific intervention services such as school counseling services for students and families. And as we're talking about comprehensive school mental health and thinking about that, we want to encourage folks to think about this entire model, that when we see the numbers that we're seeing in the youth mental health crisis, and we're thinking about what we need to be doing to address this, we want to be taking a comprehensive approach, thinking about and implementing mental health promotion practices, prevention practices for some, and treatment for others. We wanted to share some great resources that many states have taken this information around comprehensive school mental health and are actively doing this work in their own jurisdiction. So wanted to highlight a couple of comprehensive school mental health system frameworks. You'll see here on the slide a couple of examples from Wisconsin and from Colorado. Many other states have done similar work in this area and have their own frameworks So we highly recommend checking out and trying to find out more about what exactly is happening in your state as it relates to this. Many strong programs and supports that are happening. Texas just started and put together their new framework and has launched a website as well. So highly recommend you check in, and please feel free to reach out to our teams if you need any additional support finding more information about those resources. And so we want to highlight that when we're thinking about comprehensive school mental health services, and you think about that model of mental health promotion, prevention, and intervention, that there are many folks who are at the table doing this work, that we have school employed folks who are providing services. That the number of those folks can be very extensive, which we'll go through in just a moment. And we see this work happening in partnership with community providers. This is just one example of what that model can look like, where community partners may be providing more of that individualized intervention services, whereas school employed partners may be doing more of the tier 1 supports. This is just one example. This can look really different in different jurisdictions, and it may be that school districts are doing more of that tier 3 individualized intervention. But we highlight this to show that there are many ways that school systems and local jurisdictions are putting this together. And on the next slide, you'll see a long list that is not even fully inclusive of all of the folks who are at the table supporting youth mental health and supporting comprehensive school mental health systems. So to name a few of school-based providers who are working in partnership to support school mental health, this includes school psychologists, school social workers, school counselors, school nurses, and other school health personnel in collaboration with clinical social workers, psychologists, or counselors, and educators and administrators. And as you saw in that graphic, and as you think about who is on your comprehensive school mental health team, thinking also about community providers, licensed mental health professionals, including clinical social workers, psychologists, pediatricians, nurse practitioners, or physician assistants. And again, there are many, depending on the local jurisdiction, many other people who may also be supporting comprehensive school mental health in your local community. So we also wanted to highlight and bring attention to parental consent and support for school-based mental health services. There is great variability in state around minor consent laws for adolescents, and that this process for parental consent can vary by local education agency or community provider organization. Even with that in mind, we want to highlight that in most cases, it is best practice to include caregivers in youth mental health treatment. And we also just wanted to provide this definition here around consent, that consent exists when communication between a patient and provider results in the patient's agreement to undergo a specific medical service. So as you're thinking about what comprehensive school mental health looks like, and as you're thinking about what that means in terms of consent, highly recommends that you look specifically at what is listed for your state, thinking about what is involved for your local jurisdiction, and of course, considering that best practice of, regardless of those laws, that it is a best practice to include caregivers in that treatment. And with that, I am pleased to turn it over to my colleague, Sean Ornstein, who is our policy analyst and director at our National Center for School Mental Health, who's going to talk through some additional resources and then kick off our panel.
Thank you so much, Jill. Yes, hello, everyone. Again, my name is Sean Ornstein, and I'm a program and policy manager at the National Center, as well as a team member of the Medicaid SBS Technical Assistance Center. So again, for these next several slides, I'm going to highlight key resources that we hope that you will dive further into around comprehensive school mental health systems. And I'll go ahead and go through them and add the links into the chat as I wrap up. So to start, want to share the School Health Assessment and Performance Evaluation System, or the SHAPE system, which is a public access web-based platform that offers schools, districts, entities, and states a workspace and targeted resources to support school mental health quality improvement. SHAPE has many, many different features and resources, but of particular note for schools, districts, states, and entity users, we have the school mental health profile, which helps users map their school mental health services and supports. Also of note, there's the School Mental Health Quality Assessment, which helps teams assess their system using national performance standards. So these assessments, the extensive resource center, as well as many other tools on SHAPE help teams identify areas for improvement and provide a roadmap for action planning. And in addition to those resources that are available for schools, districts, and entities, the SHAPE system also has a space for state users, where states can learn about the quality of school mental health across schools and districts in their state. And this account also includes the state school mental health profile to help users map state policy, practice, and infrastructure, as well as funding at the state level to support school mental health. So we encourage you to sign up, and Jill already put the link in the chat to explore the system further. On the next slide, I wanted to highlight this resource, Advancing Comprehensive School Mental Health Systems, which synthesizes the knowledge and guidance of over 75 experts nationally. So it really dives further into areas that Jill covered in the presentation, including the importance of addressing mental health in schools and using a public health or multi-tiered system of support framework, and provides further details in those core features of comprehensive school mental health systems. The document also addresses the challenges to advancing comprehensive school mental health systems and provides recommended strategies around, for instance, developing infrastructure support and sustainable funding strategies, as well as disseminating evidence-based resources and tools. And with these strategies, the document outlines specific recommendations at the local, state, and national level. So really, with this wealth of information, this resource is really a foundational document for the field. And on the next slide, I want to specifically highlight thinking about funding sources to support student mental health. So this resource is from the Education Commission of the States, and it's titled State Funding for Student Mental Health. And again, this highlights and describes several sources of federal and state funding that states use to support school mental health. So as you can see from the graphic here, the document describes several funding sources from the Department of Education, as well as the Department of Health and Human Services. And again, highlighting with most federal funding for school mental health coming primarily from funds authorized from the Every Student Succeeds Act, many different grant programs, and of course, Medicaid. And states also use funds from state funding provided through specific appropriations and state budgets, allocations made through school funding models, as well as tax revenue earmarked for specific programs or activities. And in addition to outlining and describing these various funding sources, the document provides several different really key examples of how states have used these various funding sources, and also just gives general recommendations to state leaders around conducting landscape analyses for identifying existing supports and determining gaps, as well as strategies around diversifying different funding sources. So on the next slide, for this one is from the Hopeful Futures campaign, which represents a broad cross-section of organizations and comes out of an organization called Inseparable. So this was very exciting because the Hopeful Futures campaign released the nation's first ever state-specific report cards that examine state policies that support school mental health. So as you can see from the graphic here, that they divided these policies across 8 different categories. So school mental health professionals, school family community partnerships, teachers and staff training, funding supports, well-being checks or screening, healthy school climate, skills for life success, and mental health education. And specifically as part of their review for state funding, the Hopeful Futures campaign assessed whether the state Medicaid program covers school-based services for all Medicaid eligible students. I did just want to note that this resource was released in February of 2022. So of course there have been some changes, but nonetheless, it's a really key resource for understanding the state school mental health policy landscape. So, yep, on this next slide, this document, Advancing Comprehensive School Mental Health Systems, a guide for state education agencies, was developed in collaboration between the Council of Chief State School Officers and the National Center for School Mental Health. And it specifically describes the role of chief state school officers and their agencies to advance effective and sustainable school mental health systems, and outlines 5 key steps as shown on the slide here. I did want to highlight specifically that in that second step around forming strong and diverse partnerships, this guidance really highlights the importance of collaboration between state education agencies and state Medicaid agencies. So again, we hope that you will check out these resources and to learn more about comprehensive school mental health systems. But without further ado, I am very happy to introduce our panelists today from Massachusetts, who will discuss their efforts to leverage Medicaid to support student mental health and comprehensive school mental health systems. So on the next slide, I'm happy to introduce John Crocker, who has worked in public education for 15 years, primarily as the administrator for the Methuen Public School Systems Counseling Department. In his role as the Director of School Mental Health and Behavioral Services, he's charged with overseeing district-wide implementation and evaluation of Methuen's comprehensive school mental health system. And Mr. Crocker also founded the Massachusetts School Mental Health Consortium, a group of approximately 170 districts across Massachusetts that are committed to advocating for and implementing quality and sustainable school mental health services and supports. We're also joined by Margot Tracy, who is the manager for the Massachusetts Medicaid and CHIP Agency school-based Medicaid program. And prior to her role in the school-based Medicaid program, she worked in Mass Health's Office of Behavioral Health Initiative with a focus on early childhood mental health policy. So John, I will go ahead and pass it to you.
Wonderful. Thank you so much, Sean. So thrilled to be here today. Really appreciate the opportunity to share the potential. And I say potential because I think that we are at the precipice of being able to tap into school-based Medicaid funding in a way that is very different than what has occurred over the past several years. I'm going to start with challenges, but then I'm going to get into some bright spots for sure. When I think of specifically the Massachusetts context for school-based Medicaid claiming and what we're trying to navigate, licensure barriers have constituted for sure an issue to us being able to access school-based Medicaid claiming. Only a fraction of the available school-based mental health staff have been recognized as having the requisite license for Medicaid claiming. I know that there has been some discussion around and some guidance passed down from CMS to states that is looking at that space of licensure, especially around Department of Elementary, and in our state, the Department of Elementary and Secondary Education licensure, and how that jigsaws into the question of whether or not we can use those staff members for Medicaid claiming. That would be a huge win that would allow for us to tap into a lot of unclaimed funding that for services that we're providing right now. Secondly, I want to address this idea of the wrong pocket problem. I think this is something that is recognized in a lot of states. It is no different in Massachusetts. The bottom line is that the Medicaid funding that a school district is responsible for generating doesn't necessarily go to the schools, doesn't go to the district, it goes to the municipality. We've been working to navigate that specific problem. I think we have some ways in which we can do that effectively, and I'll talk about that on an upcoming slide. Documentation of services and collection of data. This remains a growth edge for districts, for schools. This specific aspect of clinical practice is something that we talk about a lot in Massachusetts. We provide a lot of professional development and coaching around these specific topics, but it remains a case that clinical documentation, progress monitoring, and being able to report out on those specific variables is something that remains an area of growth that many districts have to attend to. And then lastly, this piece of administrative oversight. The organization that I run, the Massachusetts School Mental Health Consortium, engaged in a very brief survey of its membership back in 2022 and asked one question: does your district employ an administrator that provides clinical supervision and clinical leadership for initiatives related to social emotional learning and mental health? Nearly 70% said no. And what that means is that the administrative tasks associated with standing up a school-based Medicaid claiming program are falling to individuals that might not have expertise or might not have the requisite knowledge to be able to do that effectively or sustain that effort. In addition to all the other things that are ultimately lost as a function of not having clinical supervision and clinical leadership, including, providing professional development resources, coaching, and the day-to-day support for staff who are providing these services. When it comes to the potential for Methuen Public Schools, the district that I work in, to access school-based Medicaid funding, we are well positioned. I think there are things that we want to navigate, and we're hopeful that in the upcoming months and years we're going to be able to make some real gains to tap into this previously untapped funding. We currently require all of our school-based mental health staff, I'm going to use that terminology to refer to school counselors, adjustment counselors, school social workers, and school psychologists. We employ all of those licensed individuals, and we treat them quite similarly. We have a comprehensive staffing model, and what that means is you are going to get a caseload. If you come and work for us, you're going to provide comprehensive care to students across all domains of need and all tiers of support, and we will honor the expertise that you have in specific areas, but we really do want to provide an opportunity for individuals to provide that comprehensive care to students, and that students can go to a single individual to get access to mental health services, academic and post-secondary planning, transition planning, and that is for general and special education services alike. So we are already requiring all of our staff to provide evidence-based therapeutic care to students across all tiers of support. That means group and individual therapeutic services. Really big on cognitive behavioral therapy in Methuen. We have a robust group therapy program. We have lots of individual therapy occurring, and at Tier 3, we have some programmatic services that support students. One program in particular at the high school supports students returning from long-term absence and typically psychiatric hospitalization, with a multitude of different providers with eyes on lots of clinical planning, lots of case management, and that has resulted in some great success for students that are experiencing a disruption to their attendance in school as a function of a psychiatric problem. We also require all of our staff to engage in psychosocial progress monitoring, measurement-based care practices. So students that are enrolled in group or individual therapeutic services are being monitored at a high frequency to be able to understand their symptom presentation relative to the specific presenting concerns that they come to the table with. So when I think of the requirement from a school-based Medicaid standpoint, we are in good standing from a documentation standpoint, which is something that I think positions us well if we are to address some of the other areas that are keeping us from claiming. In terms of untapped claiming, we have about 1,250 students that are unclaimed annually as a function of some of these other barriers, whether that's licensure or the wrong pocket problem, which means that we are positioned to receive a lot of untapped funding that could go right back to services for kids and and an investment in staffing and professional development, essentially improving our comprehensive school mental health system. More on the idea of this potential for school-based Medicaid. One of the things that I talked about in the past couple slides was this wrong pocket problem. Currently, because we are not engaged in school-based Medicaid claiming in a very large fashion, it does position us well to bargain with, to negotiate with our municipality to essentially say, we are going to invest in school-based Medicaid, but we want to guarantee that some of this funding will be oriented back to or directed back to the district. I would say that even if we were only able to get in writing an agreement for half of the available funding, that would constitute a massive win for both the schools, for the district, and also for the municipality, because we'll be generating a lot of revenue for the actual municipality, and we will also be able to claim some of that funding for our students, quite frankly. Lastly, why are we positioned well to engage in school-based Medicaid claiming? We already have clinical supervision and leadership that would allow for us to direct energy, time, resources to establishing and sustaining a school-based Medicaid claiming program. So those are some of the reasons why I think Methuen Public Schools in particular is well positioned to tap into this specific funding stream. Despite the fact that there are barriers, we are navigating those barriers, and this will unlock a lot of potential for us. I do want to note very briefly that there has been some legislative advocacy, specifically Mass Senate Bill S-2473. This is a means to ultimately provide an opportunity for school-based mental health staff to obtain dual licensure to be able to then engage in the school-based Medicaid claiming process. Quite frankly, it's a workaround. It's a way for us to dually license staff so that we can have them work in schools, be employed by schools, and engage in the school-based Medicaid claiming process. But I think that there are some massive benefits beyond the Medicaid claiming process that are noted for this specific bill. It would allow for there to be an increase in access to services outside of the school hours during some of the high volume times, after school, weekends, vacations, times like those where we know that there are massive wait lists. School-based mental health staff could then opt to provide services outside of the school-based hours in another community, and that would simply improve the landscape of mental health services for youth in general. This would also allow for some parity between the school context and the community context, and improve communication, logistics, and collaboration between those two contexts. Lastly, I just want to provide a few recommendations for readiness that we have noted as we've gone through this process. Firstly, I think that it is just best practice for clinical documentation, for measurement-based care practices, for treatment planning, for the use of evidence-based therapeutic services to be the gold standard for provision of services to any students, regardless of whether or not Medicaid claiming will be occurring. We need to raise the bar in terms of the quality of the services that are provided to students. And that will ultimately, yes, provide an opportunity for school-based Medicaid claiming to occur. But at the end of the day, it is simply the best practice that we should afford to any student receiving school-based mental health services. So upping the quality is going to be an answer for school-based Medicaid, and it is the right thing to do for kids, regardless of whether or not we're going to be tapping into a claiming situation. So improve the quality. Secondly, I think it is certainly the case that we need to continue to invest in the development of evidence-based therapeutic programming, so that we can point to the fact that, yes, when we are providing these services, we know that they are research-backed, they are quality, they are going to meet the requirements for the individuals receiving them for school-based Medicaid claiming. Clinical supervision and leadership are requisite to sustain this effort, to ensure that we can get this off the ground, that there is someone that will attend to this and put time and energy into the efforts to establish it. And again, that is there's a massive dearth of clinical leadership within schools. That is something to invest in for sure. And lastly, building awareness with stakeholders. At the end of the day, districts quite often do not know the amount of funding that is left on the table or left or untapped, that potential funding that they could access if they invested in school-based Medicaid claiming. So I hope this has been helpful in terms of providing some context in terms of some of the challenges that we're trying to navigate, some of the potential that we have established, and then some recommendations for next steps for districts that want to become well-positioned to be able to engage in this process. I'm going to pass it off to Margot for some more comments. I thank you so much for your attention.
Thank you so much, John. I just want to give a huge shout out to John because he has been a tremendous thought partner and kind of a mentor for me in rethinking Medicaid requirements and quality practice. And John, your presentation perfectly sets me up. In fact, mine might be redundant. I feel like you've already said half of what I need to say and said it so well. With John's presentation, I think he really underscores the importance of local school leadership and support from the very, very top. And this slide, this is an adapted slide. I actually delivered at a presentation last week for school superintendents and school committees. I had an aha moment when I met a physical therapist last fall when I was still onboarding to this job. And she had said to me that this was like the first year that she got all of the therapists on her under her supervision to submit care plans for all the students on their caseloads, regardless of their Medicaid status. Like this was actually a really big deal. It had taken a long time to get all the therapists to do this. And the benefit of universal documentation was that her staff actually were able to track the good work they were doing, and it was guiding their interventions. And she was pointing out to me that, you know, well, it wasn't just a Medicaid documentation requirement we were meeting. This was an actual standard of practice. What John has been saying in the realm of mental health, it is best practice. It is necessary to know what we're delivering to the students and how to improve on it. It's not an extra, it's not an add-on, it's not an additional burden from the Medicaid agency. And like John is doing, this therapist is leveraging that Medicaid requirement to ensure that all the students in her district are getting physical therapy in line with professional standards. And, you know, folks like her and John are doing amazing work, but it can't just be on the individual provider to be figuring out how to use this system. They really do need leadership from the top. And I think John's points are like perfectly heard here. Clinical leadership is so necessary because someone has to have ownership of the program, set some system-wide expectations, and also create the structures that are going to support staff participation in the program. So as you'll see on the next slide, I'm going to cover some of our efforts to do more of the, as John was talking about, engaging stakeholders and building awareness. So as I saw in the chat also, I think it was sort of news to some folks here that our state in Massachusetts, the Medicaid funding that is not necessarily directed to schools. It is unrestricted revenue that is directed to the local governmental entity. So that is a challenge. It is different in every town and municipality how that split happens, whether it's through a memorandum of understanding or, you know, a longstanding professional relationship where people help each other out. We wish we had oversight and we wish we had insight into how this is done, but what we're working with right now is trying to do as much education and outreach to school leaders. I really wish that we had a John Crocker in every single district, someone who has a sort of a systems-wide approach and thinking about leveraging requirements and practice standards to improve quality of care and also set the district up to really have a smooth Medicaid reimbursement process. We also we're hearing anecdotal reports that school committees, like, so we're in Massachusetts, we're a real local control state. School committees don't have a ton of awareness of Medicaid reimbursement or even know how much Medicaid reimbursement is coming into their town and may not even be aware of how the split happens. And we were realizing that our efforts at training the school-based provider in, you know, program requirements was kind of putting the cart before the horse because we really needed to engage school superintendents and school committees to support this program because, like, those are the folks who have the best chance of, like, one, developing a sort of a systems level approach, the kind that John is talking about for supporting mental health in his district and just applying that to all school health services. And also, these are the folks who can advocate fiercely for more of that funding to come back to schools, to supporting health and supporting learning outcomes at the same time, right? Because students are not leaving their health needs at the front door. Those health needs are affecting their ability to progress through the grades and to stay in school. So we really, really want to double down on those efforts. So these materials I'm showing you right now are just some screenshots of a conference I was just at last week. And we started off by a participant-generated word cloud. We asked participants to enter into the platform, like, what are the greatest health needs facing your district? And I think I all had a very strong hunch it was going to be mental health, which is exactly what you see there. And from that, we use that as a jumping off point to talk about, okay, well, how can Medicaid funding help you address those needs? And like, are you even thinking about how Medicaid funding could address those needs? Our goal has been to sort of reframe school-based Medicaid from a sort of a dusty, maybe not really much regarded program that might help you offset some personnel costs, to thinking about this as a source of sustainable federal funding that can help build capacity, help bridge funding. It's not going to fund everything on its own, but it is such an important piece of funding for comprehensive health services. And if you'll see on the next slide, these are some of the tools that we developed. We really wanted to help districts dig into the weeds. I think John was alluding to, some districts aren't really aware of how much they're bringing in, or just by their staff participating in the program, just doing their jobs, how much funding they're bringing in to their towns. So we developed some tools. The first tool is, if you look up there, to individual district profiles. It is simply like a historic 5-year look back, how the town or district is doing in terms of direct service claiming or administrative activity claiming, the two different streams of reimbursement. And then the grid on the right of that that slide shows just sort of opportunities for growth, where like you have a lot of staff who you're including in your personnel costs, but you're not actually claiming for the services they're providing. So we're trying to show where are the opportunities for growth. At the conference, we had a really great breakout session, and we encouraged all the districts who are in attendance to stop by our table. We're going to take you through your profile. We're going to show you what it looks like, give you some TA, some suggested next steps. And one of those next steps is to spend some time in the next tool we developed, which this does not really trip off the tongue. It's the District Health Needs and Infrastructure Assessment. This is a tool that we developed adapting from the Healthy Schools campaign. They developed an incredible suite of tools for Chicago and Illinois LEAs, really, really great tools to really engage LEAs in thinking through their infrastructure and how they support Medicaid reimbursement processes. And there is a fantastic tool. And since this tool, this assessment tool, is licensed under the Creative Commons, and I checked with Jessie Mandel at Healthy Schools Campaign to make sure I could steal shamelessly, and she encouraged me to. I took that assessment tool and I used it to adapt for Massachusetts. And this is actually like superior to a tool I developed last spring. This is much better. And what I like so much about it is it starts off asking the district to identify their greatest health needs. And then you go through the rest of the assessment, you are taking stock of your infrastructure to meet those needs, and you're taking stock of your infrastructure to support Medicaid reimbursement processes, and thinking through, okay, how would I use the Medicaid reimbursement that my district is getting to address these needs? So, we're still working hard to reach out to superintendents and school committees across the state. I have it on my to-do list to reach out to each individual regional roundtable to get me there to talk to these superintendents about investing in their program. We get that school-based Medicaid requirements can be challenging for schools to navigate because they are not traditional healthcare settings. But these requirements also are not out of left field. As John has talked about in his slides, documentation is a standard of practice. It is how we ensure quality care for students. So we just want to hope that by reframing and thinking about school-based Medicaid is a really great opportunity to build capacity and to bridge funding, that our school leaders will be more informed and more energized, and will advocate strongly to bring that back and to their districts to continue building the capacity to provide comprehensive school health services, especially mental health services. And actually, I had one other slide, but I think I'm okay, Sean, dealing with that. We can just skip over that slide because I'm just aware of time, and I know there might be some questions that folks have.
This is great. Thank you so much, John and Margot, for providing this overview of opportunities and what y'all are working on in Massachusetts. We've had lots of questions start to come in, and so I'd love to feed some of those over to you. So questions around clinical documentation. So John, you talked a lot about that you have those systems in place, and folks are asking, what does that look like? Is there an electronic health record specifically for school districts? If you can share how you all have done this or how you've seen others do it, that would be great.
Yeah, it's a great question. I don't think that an EHR is requisite to be able to get to the kind of documentation that's necessary for school-based Medicaid claiming. It might make for some efficiency. It might make for some consistency of practice. But in terms of our documentation, we're leveraging the tools that we have, our student management system, Google tools. So we have a business agreement with Google so that the data sits on our server. We're not using like private accounts or anything like that. So we feel comfortable with the security of the data, security of the permissions that we have set up. At the end of the day, I think that it's really about the types of documentation that we're collecting. I know that there are some very specific requirements, but Margot mentioned this as well. It's really about the standard of practice. We need to have a treatment plan. That treatment plan should have a specific area of focus and goal. It should be about something, meaning a presenting issue has been identified. We should have some semblance of an understanding of the progress monitoring frequency and the specific data that will be collected and what constitutes growth and intervention that's been identified. So I don't think that these things are so unique or exotic that you can't build something locally to be able to capture them. I think these really just constitute best practice relative to clinical intervention.
Thanks so much, Sean. And I know we've seen other folks nationally. I have been amazed at the systems that have been built locally in Massachusetts and Methuen and in other jurisdictions. We have seen other folks that partner with education systems to have some of that be built in. And there certainly are providers out there that do that work as well. It may look slightly different than a traditional electronic health record, but there certainly are vendors out there that can consider that as well. So other questions we've had coming in are around HIPAA and FERPA. So specifically for either of you, do you have recommendations regarding legal consultants or resources to help LEAs navigate HIPAA and FERPA boundaries as school-based mental health services are implemented?
It's so funny that you asked me that, or that question came up, because I in the presentation that I worked on last week with the conference I was telling you about for school committees and school superintendents, we did cover like what are some of the burdens or one of the barriers to participation, and a lot of the barriers that school superintendents and committee members telling us, oh, like this documentation requirement, or like these things, that these requirements are too burdensome. And I think there's concern about privacy also. I think you're talking.
We may have had Margot freeze for a second here. John, I wasn't sure if it was just me. So we'll pause, and when she comes back on, we'll continue with that question. John, I don't know if you wanted to speak to that at all, or we can move on to our next question.
I'll just say, I think at the end of the day, schools are obviously beholden to FERPA. I think FERPA ends up being the thing that we look to the most, quite frankly. And that does create some situations where we are, I don't want to say at odds, but having to explain to parents this tension between really quality clinical practice and what information they, quite frankly, can request. I'll use universal screening as an example. We screen K-12 with lots of different measures, with all of our kids around anxiety, depression, post-traumatic stress. These are information that ultimately are tied to the student record. These data don't follow these students into different contexts, But if a parent were to approach a school and say, I'm interested in seeing the screening results, from a FERPA standpoint, I would be saying, you have the right to ask for that, and I'm asking you not to. I'm asking you to ultimately honor the fact that we want to create a therapeutic setting where students can feel comfortable answering these questions and getting support. And I would tell you if this would require me to breach confidentiality, if I had a serious concern, or if I need to follow up with you in any way. There are limits to my confidentiality. I will tell you that 99% of the time, parents have appreciated that answer and they said, okay, I'm not going to ask for that. But that is a very interesting and unique tension that schools have to work through, because FERPA is something that allows for a peek at some of the things that are occurring from a clinical standpoint. So some barrier setting, boundary setting is important.
And our colleagues and partners in this work at the Department of Education have highlighted that the Medicaid School-Based Services Guide has significant information about navigating FERPA and HIPAA, and we'll go ahead and put the link to that in the chat. But great questions, and I think, summary that there is certainly ways to navigate this. We've seen many school districts. Oftentimes it comes up as a barrier, but it's certainly not an insurmountable one. We've seen in Maryland lots of good work in terms of being able to navigate that. Additional questions we have coming through, and let's see. One, we may want to wait for Margot here. But so thinking more specifically about clarification around license. So a colleague from Arizona is sharing that there's different levels of licensure for social workers. And could you share a little bit more about that in Massachusetts?
It's such a great question. And I'll say that the licensure space for this topic is probably the one that is most diffuse, disparate between states. There is so much state level licensure question when it comes to like what constitutes licensed. I think that, in Massachusetts in particular, I think of the issues related to the Department of Elementary and Secondary Education licenses and licenses that extend for community-based mental health services. And a lot of the work that we've been trying to do, and the arguments we're trying to make, is that quality mental health services can happen in both contexts, and we're really looking for parity between these roles when it comes to Medicaid claiming. So I think that I appreciate the call out, like, how does that, what do you mean from a Massachusetts standpoint? In Arizona, we have these two levels. And I guess I'll say in Massachusetts, we have some licenses that are currently approved to bill for Medicaid. We have some that aren't. And we're at the precipice of some guidance that I think points us to, well, maybe all of these licenses actually can be from a state level approved, but these are steps that we need to take in order to better access school-based Medicaid claiming. So it is going to look differently in really many states. Margot, we were talking about really like the licenses that have been approved for school-based Medicaid claiming and how that's so disparate between states. And really it's comparing apples to oranges sometimes because of just the different ways in which we talk about license between school, between community, and then also there are nuances even within those specific contexts in terms of who's doing what.
And thank you for covering for me, John. I had an inexplicable loss of internet again. It also happened right at the start of the webinar, so I'm back. And I did want to call out, as John had mentioned during the presentation, the licensure issue, and we at Mass Health are actively looking into that flexibility that the new CMS guidance is allowing for educationally licensed providers who are like licensed to work in schools. So we are looking at which providers, expanding our qualified providers. So I will be in touch with you, John, because I would love your thought partnership on this too, and thinking about the outreach and the training that's required. This is still a work in progress for us because it still feels so new. Even though this guidance came out in May, there's still so much to pour over and think about which flexibilities we want to take advantage of. but knowing that there is a huge body of mental health providers in schools who are not currently in our program, and that is that's such potential. But I think it's also thinking about that role, and I feel like that role is a little bit in flux too. The traditional guidance counselor role has really, really morphed into one of more of a mental health provider. And I think that in terms of thinking what these providers do, I think that identity, figuring out what that identity is for the provider, as John has also shared with me through, as I mentioned, he's sort of like a mentor and a thought partner when I started this job, showed me a lot of like the overlap between the programs that train school counselors or traditional counselors and mental health counselors. There's such overlap. And how do we, like, there are barriers that we could remove. So actively working on that. And I think there was also a question about guidance, and I think maybe you already put a link in the chat about I think it's 2020 or 2019, the joint guidance from the Department of Education and CMS on the intersections of FERPA and HIPAA. Was that already dropped into the chat? Okay, great. Because that was that was what I was in the middle of saying. I said to school committees and superintendents that, like, I cannot advise them other than to consult their legal counsel and make sure they're developing, making their expectations around documentation clear and consistent for their providers, and refer them to the same document that you posted.
Thank you so much, Margot. That's perfect. Okay, additional question that came in that our experts at CMS answered for us, but just wanted to share this aloud for others. There's a question around who provides non-federal match and how is that budgeted? And our experts at CMS shared that typically in states, either fee-for-service, managed care, or the most popular are certified public expenditures. Yeah. And that just wanted to flag for folks that the comprehensive guide on school-based services provides more information there. Margot, I see you giving that a thumbs up too.
Yes, excellent. We are the third option. Yeah.
Great. Excellent. Okay, so thank you for everyone for questions coming in here. We also want to make sure we have some time to have some discussion with the group, and mainly this will look like adding this information. You can either add it in the chat to the hosts and panelists, and we'll share it aloud, or you can also put it into the Q&A. But we would love to hear more about, for folks who are on the call and in this work, is how your state has been successful in billing or receiving reimbursement for services as it relates to comprehensive school mental health, or opportunities you're seeing that really there is such strength in us learning from one another. So we wanted to leverage some of that as we are wrapping up our call here. So please feel free to put any of that into the chat, and we will share that aloud as that is coming through. And questions, Margot, about the district health needs assessment, but folks would love to see that, and we'll defer to y'all whether we can share that forward. Great.
Sure.
And we had a couple of more specific questions that have come through in the question and answer, and please know that we will be sure to document all of those and answer those. You'll see those coming through in the Q&A document that comes out at the end of this call. Looking to see if we've had any descriptions coming through here, but we welcome, even if you don't put these in the call now, to share. Oh, great. Thank you, Rhode Island, our wonderful colleague. So has shared that in Rhode Island, we continue to work with our state Medicaid agency on an expanded waiver. And I have the honor of working closely with Rhode Island and hearing about their amazing work related to this. And so thank you so much for sharing that good work that's happening there as they look towards that expanded waiver. And I know they work closely with their state Medicaid agency. Checking to see if we have other details coming through here about what's happening in other jurisdictions. Okay, great. In Nevada, a Medicaid policy for school health services is in place, and collaboration between program specialists in participating schools. Excellent. Thank you so much for sharing that. And again, we know in this work it looks different in every state, but our goal is to learn from one another and to hear some of these different models. So thank you so much for those who are on the call that are sharing these forward. And we encourage you to please continue to reach out to the Medicaid School-Based Services Technical Assistance Center to ask your questions, to share some of these successes and opportunities. We welcome you to be in touch around this work. We are thrilled to have such a huge group with us today, talking about this important issue, talking about how we can leverage Medicaid funding and advance comprehensive school mental health systems. We know this is such a critical need. We are so thankful to John Crocker and Margot Tracy for joining us today. Thank you so much for being willing to come on and share candidly about the work that's happening in Massachusetts and opportunity. We are extremely grateful for your time and grateful for everyone's time here who has joined the call. Thank you so much, and we look forward to being in touch soon. Have a great afternoon, everyone.